Welcome to Navigating Nursing School with your nursing tutor. On today's episode, do you know that annoying classmate that seems like they never study and yet they get amazing grades and you can't figure out why? And when you go talk to them and you say, "What do you do?" they always answer with, "Oh, it's easy. I just," and then they fill in the blanks with something that you're already doing. I just ignore lecture and read the textbook. I just never do the readings and only watch YouTube videos. I just skip the assignments and only focus on what she talks about in lecture and on the PowerPoint slides. Whatever it is, you know something's not clicking. Why does it work for them and it doesn't work for you? Today, I am going to explain why, and it comes down to two simple concepts that I wish every nursing student, every nursing school should tell you about, but they don't for some reason. I'd say that over half the nursing tutoring students I work with have never heard of these two simple study concepts. So we're going to talk about them today, and then you will be in the half of nursing students that do know about them, which is going to help your study habits in nursing school. Before we get started, let me introduce myself. My name is Nicole. I am a professional nursing tutor with over 15 years experience helping nursing students just like you get through nursing school confidently and calmly. And if you're a pre-nursing student, I can help you prepare so that you never have those nursing school horror stories that you've heard so much about. I do this through my website, yournursingtutor.com, and I also offer a group tutoring membership that students can join and get affordable group tutoring sessions weekly and also have access to me to ask any questions they want unlimited times per week through our members-only forum. We also have a library of resources that help you with everything you need in nursing school, from how to study, how to do dosage calculations, managing test anxiety, time management, and more. So if that sounds good to you, just head on over to yournursingtutor.com and check it out. I also have a freebie for you if you want to learn the best way to study in nursing school, which is my Silver Bullet study system. You can go to yournursingtutor.com/SBSS. And I will send you a free 10-minute video that explains my entire 4-step Silver Bullet study system method so that you can get started using it in nursing school today. So let's get on to what are these two simple study, what are they, like philosophies or tactics, whatever, that they should be required for everybody to learn before starting school, but they really, most people don't hear about them. And it really is what makes the difference between two students who study using the exact same tactics and yet get wildly different results. The two concepts are active learning strategies versus passive learning strategies. So I'd be curious if you've ever heard of these. I would be. So, but I would almost guarantee, like every nursing student that I work with, if they're struggling in nursing school, they are using a majority of passive learning strategies. And so let me explain the difference between what passive learning strategies and active learning strategies are, and then I'm going to give you some tips on how you can take the way you study now. If you recognize that you probably are using passive learning strategies, I'm going to give you some tips for how you can easily transform those passive learning strategies into active learning strategies so that you can start getting better results and being more effective with your study time. So first of all, passive learning strategies is kind of what it sounds like, but it doesn't mean you're not working hard. Okay, so passive learning strategies would be like you're passively receiving the information. So I kind of think about a couch potato. When you're sitting on the couch watching TV, you're passively being entertained. And it feels like you're learning a lot, you're seeing a lot, you're doing a lot of entertainment. But it's still passive because you're doing the receiving. You're not actively doing anything for that entertainment. Now, if you were, doing a board game with your kids or playing charades with a bunch of friends, that would be an example. If it was learning, that would be an example of like something that's more active. So it'd be like active entertainment. Like you have to get up and actually be thinking through things. How am I going to act out this charade? What are the rules to this game? What's my strategy for winning? You're more engaged in the activity. You're still being entertained. In both situations, you're being entertained, whether you're sitting on the couch passively watching or actively engaging in the process in a game or something. So it's the same way with learning strategies and studying. A lot of times students will engage in passive learning strategies. These are honestly, they're the most common study tactics that I see. and they are the least effective. And there's been research that shows this as well. So these would be things like reading the textbook, listening to lecture, watching videos, okay? Highlighting notes. I always like to add that in because it's easy to highlight notes, but it's not very effective for studying without a larger strategy. And here's why. But you can hear, flashcards, memorization. That's another passive learning strategy. But I'm sure we can both agree that these are the most common study techniques that are encouraged in our American education system and, most Western education systems. And yet they are the least effective. So if you have a classmate who is using one of these, who claims that they are using one of these study tactics in order to get their results, I guarantee you that they are doing something more. They are interacting with that resource more in a way that they're not even realizing, that turns it into an active learning strategy. So what would be an example of active learning strategies? Active learning strategies is anything where you need to more actively engage or be I think of it usually like you have to be producing something. So this is why you hear that discussion-based learning is good. It's also when you've probably heard, if you can teach something back, then you learn it better. That's absolutely 100% true. Okay. So anything where you can explain it back, you can teach it back, these are going to be more active learning strategies, but they hurt your brain more. Okay. Because they're harder to do. They require more thought and effort. And so I think for this reason, among others, nursing students tend to avoid them because you already feel so overwhelmed with nursing school and the amount of content you're asked to cover and things like that, that to be told, you should study things using active learning strategies feels overwhelming. However, I am here. I have been a professional nursing tutor for 15 years. And so I have to tell you that you are doing yourself a disservice if you do not use active learning strategies. Okay? And here's an example. It's a little bit of math, but I keep it easy for you. I usually give this example to kind of illustrate the benefit of switching to active learning strategies, especially over the long term. But let's say you have 100 nursing facts that you have to learn for your next test, and it feels overwhelming. Now you have a choice. You can use passive learning strategies, and you can study all 100 facts, but you're only going to retain about 40% of that. And that's generous. Probably you're only going to retain 20 to 30%, but we'll say 40% for this example, right? Now, if you use active learning strategies, the individual active learning strategies might take you a little extra time compared to passively going through the material. But you're going to be studying it at a deeper level. Therefore, you might not have time to get through all 100 pieces of information. Okay, maybe you only have time to get through, let's say, 60 of them, 60 out of 100. But, and here's the thing, you're going to remember, research suggests that when you're using active learning strategies, you're going to remember more like 70 to 90% of what you studied with active learning strategies. So if you do that math, and I probably should have done this math ahead of time, I'm doing it off the top of my head. But if you studied only 60 of your 100 facts, but if you're going to remember, let's say 75, because I think I can do that in my head, 75% of that 60, that ends up to be, I'm just going to pull up my calculator because I'm not going to risk getting this wrong while I'm recording. That's 45 facts, okay? So in that case, you're going to remember 45 of those 100 facts. Even though you only studied 60 of them, you're going to end up remembering more than if you studied everything using the passive learning strategies, okay? And these percentages are based off of a research study that was done that kind of measured students who used different types of study techniques and how much they retained after a certain amount of time. So you can see that even if you study less of the content, you're going to remember more of it and be able to apply it to the test. And then here's the thing. It has a ripple effect. It has a ripple effect, because when you study using active learning strategies, it sort of automatically improves your critical thinking. And in nursing school, that improves your clinical judgment skills, which is really what you're being tested on all your exams. So as you improve your critical thinking and your clinical judgment, you're learning to think like a nurse better. And that means that you're going to do even better on your exam than you would predict, given the fact that you only, quote unquote, know 45 of the 100 facts that you needed to know in this example that I'm using to illustrate. Because you're not actually being tested on those facts. You're being tested on how to think about those facts. If you hang out with me any amount of time, you eventually hear me say stuff like that. You're not being tested on facts in nursing school. You're being tested on how to think about those facts. And when you use active learning strategies, you practice that skill of how to think more than if you're just doing passive learning strategies, and that skill is transferable. The skill is transferable. That means that even if you get asked about, fact number 75 that you never studied, maybe it's something about the respiratory system, and you did review the normal anatomy and physiology of the respiratory system, and maybe you studied another respiratory disease on fact number 25, and you're like, you know what? Those two things have something in common. So I don't know for sure the answer, but I can make a really good guess based on what I learned over here, and now I can apply it to this thing that I didn't have as much time to study. And you're going to increase the probability of getting those questions right, even though you never specifically studied them. And that is the goal in nursing school, because guess what? When you get to NCLEX, I guarantee you they are going to ask you questions that you never learned. You never studied that particular fact, because they can literally ask you anything, right? But no matter what facts they ask you about, what they're really testing you on is how to think. And so they don't expect you to get every question right on NCLEX. They expect you to be able to figure things out kind of on the fly, and be able to put the information, to have a basic foundation of nursing knowledge. There are some things you do have to know, but then to use that foundational knowledge and think about it to be able to draw conclusions and analyze and apply in other situations that you may not have specifically studied. It's a skill of how to think. Can you think well enough to be a safe and effective beginning nurse? That is why active learning strategies are so important. So if you're hearing this and you're like, okay, great, how do I switch from passive learning strategies to active learning strategies without overwhelming myself? There's a couple of different things I would recommend. First of all, you have to self-diagnose. What are your preferred passive learning strategies? Like I said, I see a lot of students highlighting, copying their notes, watching YouTube videos, or TikTok videos, even mine. You don't want to do that too much without a strategy. And that's the thing, is that whatever study technique you're using, that's just a tactic. So there's a difference between tactics and strategies. Tactics are the very specific things that you do that all fit together to create a bigger strategy. The strategy is sort of the plan and the thought process, the bigger reason why you are doing those tactics. So you can use things like copying your notes and highlighting and flashcards and listening to lecture and all that, as long as you are using them with a larger strategy, okay? Any of those tactics can work if you have the bigger strategy that transforms them into an active learning strategy. And this is why, your annoying classmate who seems to do well without even hardly studying, and then tells you, to do all the things you're already doing but don't work for you. They are somehow, probably accidentally, they are somehow using these tactics in an active learning way. Now, the easiest way I have seen to help nursing students transition from passive learning strategies to active learning strategies is with the Silver Bullet study system, which I mentioned earlier. And again, if you want to learn more about that, you can get it for free, a free overview at yournursingtutor.com/SBSS. That's SBSS for Silver Bullet Study System. And I'll send you a free 10-minute video, like I said. Or you can work with me in my group tutoring membership. I also have some one-on-one tutoring slots available and things like that. There's lots of ways you can learn the Silver Bullet Study System from me, but the free video is the best place to start. And when you do that, it guides you through what you need to do and turns it into an active learning strategy. It's because step 1 and 2 ask you questions that point you to what the most important information is. And so you have to be thinking about it. And this is why I get in trouble with people sometimes, because I advise you, I'm like, you don't read your textbook. You know, I don't want you reading your textbook like a novel. I want you reading your textbook like a dictionary. Nobody reads a dictionary from beginning to end. You read a dictionary just based on what you need to know. So in order to know what you need to read in the dictionary and how much to read, you have to start with a question. So you have to know what question to ask. With the dictionary, it's easy. You say, how do you spell this word, or what does this word mean? With nursing content, in order to effectively read your textbook, you need to start with a question. You need to say something like, what do I need to know about normal before I can begin to understand this disease process? Or given what I know about normal, what has broken or changed? What's the pathophysiology for this disease process? And when you do those things, now you're automatically, because you're asking a question, you're activating your brain. That automatically turns it into an active learning strategy, which is going to, right there, it's going to increase your understanding and your retention. I hear a lot of adult learners, because most of the tutoring students I work with are adult learners who are going back to school after being out for a while. And I find that a lot of them complain that they have quote unquote old brains and just can't remember things the way they used to. I don't think it's the problem is that you have old brains. It's that you are you're using passive learning strategies so things don't stick. That's a normal brain, to be honest with you. It's a normal brain. And once those adult learners switch to active learning strategies, ta-da, their retention automatically improves as well, proving they don't have old brains. Okay? And so we can get through by asking these questions and turning it into active learning strategies, but still using the same tactics. You can still read the textbook, but now we're not reading it from start to finish. We're asking a question, we're diving into the textbook, getting the answer we need, and then getting out. Okay? If you like using Google, Google is a great resource. If you like watching YouTube videos, that's fine, but first you have to know, what do I need to know? What kind of YouTube video am I going to look for? What is the information I'm looking for? And then you look for that kind of YouTube video instead of just watching endless YouTube videos. Anybody guilty of that? Like watching endless YouTube videos that are just like, what if I need to know this? What if I need to know that? What if I need to know that? If that's the question you're asking, that's a passive learning question. You need to be asking yourself active learning strategy questions. Now, this can also lead into lecture. I do recommend doing this kind of baseline steps, at least steps 1 and 2 of the Silver Bullet study system before lecture if you can, because then when you get to lecture, it like supercharges your lecture experience. Instead of just sitting there glazed over, wondering what in the world your instructor is talking about and getting frustrated because she's just reading off the PowerPoint slides and acting like you're dumb for not understanding or following along, you're actually going to start following along because you've already laid the foundation for making connections, because you've already started making connections for yourself in your own study time. And then when you get to lecture and she's talking, you're going to start to see the connections that she's not making, at least not in lecture, but she has made in her head. Okay, I know that sounds kind of strange. It might sound a little abstract. It's the kind of thing that it might be hard for you to believe until you actually experience it. But this is what happens when you study this way. Okay, it's what happens when you start using active learning strategies, especially when you can use them before your lecture. And then you walk into class prepared, which impresses your instructor, by the way. But also, that's not why we're doing it, though. We're doing it so that you can think like a nurse faster and easier and better. And then if you have time to do steps 3 and 4 of the Silver Bullet study system before class, that's even better, because that's really where you get to practice your active learning strategies. And a lot of students will give me a little pushback sometimes because they're like, oh, it sounds like this is going to take too long to use the Silver Bullet study system. And I'm always like, well, is the way you're studying now working? Like, you said you're already studying too much and not getting the results you want. And then they just kind of like look at me and like, no, it's not working. Okay, well then you need to do something different. And I'm telling you this works. So it's up to you if you want to try it or not. But I've been doing this a long time, longer than you've been in nursing school, and it works. So you choose. But here's the thing. It's like going to the gym. You know, you can't just say, okay, let me try the Silver Bullet study system, and you do it once and you don't even use the right technique. And then you go home and you're like, well, I I didn't get any stronger and I feel sore now. So this doesn't work. I'm going back to my old ways of sitting on the couch and just watching stuff. Okay. No, of course not. That's ridiculous. But if we think of studying the same way we think of working out, like working out our muscles, you can see how smart it is to study with the silver bullet study system. Because when you go and let's say you're going to, do some bicep curls or something, right? You do a couple sets in the gym. You don't expect to have a noticeable difference and, increase in strength in your muscles after one day in the gym. You have to do it consistently over time, right? Not too much, not too little. You're going to be a little sore. It's going to be uncomfortable. It's going to be hard to get through the set even. It's the same way with studying. It's like building up the muscle brain, the muscle power to be able to think like a nurse. It takes time and consistency and the right technique. I have some people who will start using the silver bullet study system, but they only use it as a way to organize their notes, which is a passive learning strategy. So even my silver bullet study system, you can use passive techniques and you will not get the results. You have to do it the way I teach, using active tactics and active techniques as you study in order to get the best results. But if you do that, then over time you will find that nursing school gets easier instead of harder as you go. I just had one of my tutoring students who's been with me a long time. She's been with me since her last prerequisite semester before she started nursing school, and she's going to be graduating in a few months. And she came to a recent group tutoring session to get some feedback on a really advanced silver bullet study system outline she had done. And she was sharing with everybody that back when she first started nursing school, she remembers me telling her that using these advanced techniques, eventually it would be like second nature to her, and that nursing school would get easier instead of harder. And she had a hard time believing it. But now that she's in her last semester, she said she showed up to her first lecture on, which was critical care. And she was really nervous because everybody says how hard that's going to be. And she said they were talking about these head injuries and shock and all this stuff. And she followed right along. She said she saw for the first time how true what I had told her was, that because she had put in the time and the effort and the reps and consistently been using the silver bullet study system and building her firm foundation of nursing knowledge, that now it's paying off for her. It's been paying off for her the whole time because she's been passing comfortably and getting through nursing school. And that it's still challenging. Like, she still has to put in the time and the effort to study even now in her last semester. But it's easier because that foundation has been built. She knows how to think. Her brain knows what patterns to be connecting, how to connect the dots, so that when she's presented with these new critical care topics, she sees how they fit together. And then she just has to go through the process of putting it together for herself, but she knows how to do that now. So it's totally doable and not overwhelming. And I want that for you too. Anybody can get that. Any nursing student can and should get there by the time they graduate. And I found that the easiest and most concrete way to do that is with the silver bullet study system. So hopefully that helps you today. If nothing else, what you can start doing is, instead of recopying your notes, never, ever, ever copy notes. Write things in your own words, okay? Never, ever, ever highlight in textbooks. If it's important enough to highlight in a textbook, it's important enough to rewrite in your own words. If it's not important enough to rewrite in your own words, it's not important enough to highlight. Because the process of writing something in your own words, that is an active learning strategy. The process of highlighting, passive. The process of just literally recopying your notes, passive. You have to do something active that changes it or whatever. You also, another quick tip is teach it back. I always say, if you have a pet, explain the concept to your pet. If you don't have a pet, explain it to your lamp. Everybody's got a lamp, okay? You look a little silly, you feel a little silly, but guess what? You're going to learn the information better. So even if you can just pretend to talk it out to somebody, not only is it going to be beneficial for you now in nursing school, it's also going to help out with your future patients in the future, because they don't want to hear things in medical jargon. They're going to need things explained to them like a fourth grader, because they're sick, they're scared, they don't understand. The doctor came in and they probably just agreed with everything the doctor said because they were sick and scared and didn't want to feel dumb. And now you're the nurse here and they're still sick and scared and they still don't fully understand what's going on. And you're going to be able to explain it to them because you took the time in nursing school to learn how to put things in your own words instead of just relying on the memorized medical jargon. So doing these skills not only helps you in nursing school, but it's going to help you become a much better nurse in the future as well. So I hope that helps. If you got some good value today, if you are now in the less than 50% of nursing students that know the difference between active and passive learning strategies, I would love it if you could go to Apple Podcast and give me a 5-star review for navigating nursing school with your nursing tutor. That helps to spread the word to other nursing students and to other nurses who are also wanting to help students get through nursing school confidently and calmly. Until next time, you remember you can get a free copy of the Silver Bullet Study System overview at yournursingtutor.com/SBSS. And until then, good luck on your nursing school journey.